We're going to talk some more about skincare right now. Tips for your tweens and teens. And we're going to shatter some of the myths about breakouts. Joining us right now is Bay Area dermatologist, again, Dr. Marie Jen. Good to see you.
Hi, Dr. Jen.
Welcome back to the show.
Thanks for having me back.
Thank you. Why is it that teenagers have so many skin problems?
At this age, you know, the hormones become elevated, so their body's changing, and because of that, the elevated hormones, that affects your oil glands, your oil production, and then you get acne and the problems with acne.
What age does it normally start?
It can start anywhere from 10 to 12 to 13, so tweens and teens are the ages.
Yeah, and it can last a few years, right?
Oh, gosh, it can last up to age 20. And after that, we call it adult acne.
That's what I have, age 35, 36.
Oh, you're doing fine.
Seriously, why do I still get pimples? And I'm in my mid-30s.
I'm seeing more and more people with adult acne. I think a lot of it is what we eat and different stressors and...
Stop looking at me.
No.
Like I don't eat well or something.
No, you eat well. It's just I'm always picking on you, you know, about eating like a kid. Well, so what are some of the good skincare habits parents can encourage kids to develop?
I think this is a great age for parents to really encourage their teens and tweens to take care of their skin and, you know, develop really good habits. Because, you know, acne is a problem.
Yeah.
So you want to encourage them to develop good habits, clean their skin, and to prevent it from damages from harsh cosmetics from the sun.
So cleansing is one of the first
thing
right?
would be to cleanse, and I would suggest using a gentle cleanser. So,
like one of these?
you know, I have a 12-year-old tween, and the first thing I taught her was to clean her skin.
Yeah.
Like every night, every morning?
Every night, I have her use a gentle cleanser, and we have some gentle cleansers here, and and no scrubbing, just gentle and then water and wash it off.
Yeah.
I'm also a big fan of toners. Toners are different than astringents. They're not alcohol-based.
Yeah.
So I have her use a toner right afterwards. And that gets rid of the excess oil, makeup, dirt that may have accumulated during the day.
Right.
And also make sure they start shampooing their hair at least 3 or 4 times a week. And if they have oily scalp, every day.
Gotcha.
So that's a first step.
Now, how important is it to protect the skin from sun?
Very important. So, you know, we get most of our lifetime sun exposure, 80% of it before the age 18.
Wow.
So the damage is done during our teens and tweens. So really important to encourage sunblock every day. Also, if you remember, acne medications make you more sun sensitive. So you want to make sure they are wearing sunscreen.
And the kinds of products you're talking about here are things that can be found widely at pharmaceutical, drugstores and
all these products that I have here are all over the counter, so you can find them. I think it's also important at this point as a parent to look at the labels with your teen and tweens to help them understand what it means to be non-comedogenic, non-acne forming.
Like, what's the difference? I know they both dry your skin, benzoyl peroxide and salicylic acid.
So they're both acids. So part of acne is you developing excess oils. So the medications, all acne medications, work by trying to decrease the oil in your skin.
So do they work both the same, or is one more effective?
They're pretty similar.
Okay.
Now, when teenagers develop acne, they have such a tendency to, you know, touch their skin or pop the pimples.
That's the fourth secret to maintaining healthy skin.
Don't do that?
Yeah.
Tell them to keep everything off their face.
Like all
so
their hands?
that includes their hands. Don't encourage them not to pop or pick. Have their hair off their faces when they're going to sleep. Helmets, tight hats. Make sure, you know, they don't wear stuff like that. And makeup. Make sure it's, you know, oil-free and non-acne forming.
Okay. Now let's talk about some myths. I've heard chocolate can cause acne.
That is not true at all. You can eat all the chocolate and sugar and potato chips, and that won't cause acne. There hasn't been any real studies that show a link.
Okay.
However, some studies show a link with milk and iodine, which is found in seafood. Now, remember, we want to encourage our teens and tweens to eat healthy. So don't eat all the chocolate. But
I've heard lots of people say, just let it run its course. The acne will, you know, it'll clear it up by itself. Is that true, or should we try to help it along?
Yeah, I think that if you let it run its course, sometimes it can lead to scarring, and scarring can be permanent. So letting it run its course may not be the most effective.
Yeah.
So treat it with one of these.
Treat it. Definitely.
Don't pop it, but
treat it and give it at least a month to 2 months before you say it's not working. And if it's not working at that point, then you do want to see a dermatologist.
And acne is not always the result of poor hygienic habits. It's just a naturally occurring thing, right?
So that's another myth. People think if I scrub my face hard enough, I'm not going to have acne.
Yeah.
You're still going to have acne. If you have the genetics for it, you will have acne.
I don't know if you can answer this. I'm just going to throw this out there. I recently heard that toothpaste can get rid of a pimple. Have you heard that?
I think anything that dries out a pimple may help, but it's temporary. It's not going to be you're still going to get acne, develop new ones.
But your skin won't have any cavities.
When makeup, does that cause even more acne?
Makeup can clog the pores, but you can wear makeup. Just make sure it's non-comedogenic and oil-free. But I have patients who have a pimple and they cover it up. That produces more acne, and then they keep covering it up.
And just quickly, how do you know when it's time to see a dermatologist, when you need more help than you can get across the counter?
I think really important, it's important if your child is starting to get very embarrassed and shy and self-conscious. If the over-the-counter products do not work after 2 months, if they're developing scarring, or if they have cysts or nodules or pus almost half their face, and if they start to get discoloration.
Okay.
Dr.
Go
Marie
see Dr. Jen.
Thank you so much. Such a
Nice
pleasure.
to meet you. Thanks for all your advice.
Okay.